Good morning, good afternoon, everybody joining us here now live or in the future via recorded on the magic of the World Wide Web. I'm Don Calloway, Vice President of Equity, Inclusion, and Impact at Enviva, the world's largest renewable energy company. And I am so happy and excited to be our moderator here today for a most important panel. Welcome one, welcome all to Global Blood Therapeutics and the National Caucus of Black State Legislators discussion today of sickle cell anemia, a call to action. This is a specific call to action webinar about what we can do to help prevent and help stop the spread and help really capture the spread of the disease of sickle cell anemia. We know two things. Specifically, number one, sickle cell anemia is a disease that is inherent and specific to African American bloodline. So it is specific to us as a people. And number two, we know that healthcare and healthcare administration in this country is something that is particularly handled on the local level. So it's incredibly important that all of us figure out the state of sickle cell in your state, and we come away from this discussion with legislation, call to actions, real action items about how we can tackle the spread and proliferation of sickle cell and handle healthcare for sickle cell specifically in your state. We've got some fantastic African American state legislators from NBCSL who are going to talk about what they're doing specifically in their state and what you can do to support legislative efforts to curb the spread and proliferation of sickle cell in your home state. A few really quick housekeeping agenda items. Make sure you express your questions and comments directly in the chat, and there's space for that, as you can see to the right of your screen. And set your view to speaker view to enhance your viewing experience. But we are so thankful to Global Blood Therapeutics, as well as all of our healthcare experts at NBCSL for bringing this important discussion together. Stay on mute at all times. We're 2 years into this pandemic. Y'all know how to use Zoom. Very excited to be here with you all. I am going to move along here in the show by introducing the president of NBCSL. As you all will see, Georgia is extraordinarily well represented here today throughout our webinar. And I'm going to move now to the president of NBCSL, Democratic State Representative from Stone Mountain, Georgia, representing Georgia's 88th District, Representative Billy Mitchell.
Don, thank you so very much. I am so grateful to be with you, particularly on this occasion. Certainly, too, want to thank Global Blood Therapeutics for partnering with us to get this information out. This is an issue that's not only important nationally, it's something that our chamber has grasped. I'm glad to see Representative Gloria Frazier on the call. She has been certainly in the forefront and has been our leader on this particular issue. Glad to see Representative, our Vice President, Representative Harold Love on the call, has done some amazing things in Tennessee with this law. As a matter of fact, it was copied in Kentucky. Our parliamentarian Gerald Neal stole a bill that Harold Love promoted there and passed there. And I'm happy to say that I'm going to get with Representative Frazier, and we're going to do the same movement here in Georgia. You know, when we talk about, as an aside, oftentimes folk ask me, what was the most important legislation that you have passed since you've been in the legislature? And it's going on 20 years for me. And I say that the most important legislation that we've passed since I've been there in 20 years has been the passage of medicinal marijuana. Now, some of them looked at me like I imagine some of you are saying, what is he talking about, marijuana? Well, the reality is, the reason why I say that is that in Georgia, we don't really have a minority or women or small business participation program. We have one in title, but not in substance. Well, when we tried to pass that legislation, they needed our support to get it passed. And we said, look, If you wish to have this passed, we want that in that bill. We don't want to be just consumers. We want it in that particular bill. They placed it in it. We also said, look, there are people in jail now that have been convicted for what we are now making legal. We want criminal justice reform. They put that in the bill. But most importantly, because of Representative Frazier's advocacy and others, we said we also want other maladies like sickle cell anemia to be in the bill as well. So we have the basis of healthcare reform. And I want to thank some of you partners on this call for helping us get that done. NBCSL is moving into a space where we wish to be advocates for good policy all over this nation. And we're doing that with the Public Policy Research Institute that we have. And I must say that this issue is in the forefront of what we want to do. Thanks a lot, Don. Thank you all, Global Blood Therapeutics, and glad that you're part of this webinar. Good to be with you all.
Thank you so much, President Representative Billy Mitchell from Georgia. Let's be clear about something. In a universe in which the vast majority of African-American legislators throughout this country serve in the minorities of their state legislature, it is incredibly important that we have a unifying force, a dynamic president like the gentleman from Stone Mountain. So thank you, Representative Mitchell, for all of the work you do. Now, one more thing, and I talked about this a little bit before the housekeeping. This is not just a webinar. One thing we are really, really good at as a people is meetings. We have meetings before the meeting. We have meetings for the sake of meetings. This ain't a meeting. This is a call to action. All of us are supposed to come out of here with an understanding of the legislation that we are supposed to file to fight against sickle cell anemia, both on the state level and the federal level. And we're supposed to come out of here with the beginning of organizing about how to pass and advocate for and pass for that legislation, both federally here in Washington, D.C. and in your state legislature. Let's remember that this is a call to organizing and a call to action about fighting sickle cell anemia. Ain't no meetings for the sake of meetings. No more time for that in 2022. Before we move forward, as you all know, with the administration of healthcare, every patient needs an advocate. Repeat that to yourself. Every patient needs an advocate, particularly African-American patients who are fighting sickle cell disease to a disproportionate degree. I'm going to now introduce our dynamic patient advocate, Mapalar Don, who is going to talk about the patient experience with sickle cell and what we can all do as a community to best advocate for patients and families dealing with this terrible disease. Sister Don, thank you so much for joining us today. You have the floor.
Thank you so much. And hello, everyone. I am so honored to speak before you all today about my family's experience with sickle cell disease. Sickle cell disease is a very brutal disease, and it affects every aspect of a person's life, from the physical to the mental to academics and even social. It manifests in so many ways and impacts every patient differently. As a mother of 3 daughters who all suffer from this disease, just in the last 8 years, we have experienced pain crises, over 100 blood transfusions, 10 surgeries, one of which was a major brain surgery, and too many hospitalizations to count. It has been said that sickle cell disease is not a very attractive for members of Congress or politicians. Now, I must admit that actually hurt my feelings because, as you can imagine, sickle cell disease is my life. But I get it. Members of Congress or politicians want to be able to go back to their home and, brag to their constituents about what they've been able to accomplish. But the commenter also said something that I believe bears repeating here. While expanding the CDC data collection to all or establishing centers of excellence for the comprehensive treatment of people living with sickle cell disease, pediatric through adult care, while that may not be attractive to all politicians or all members of Congress, maybe this is something that the Congressional Black Caucus can work on. He said that because, quite honestly, the sickle cell community consists predominantly of your people. the advancement of sickle cell disease is more likely to thrive at your table because you've all had a front row seat at the extreme trauma that sickle cell causes families. You've seen the hurt, you've seen the pain, and sadly, some of you have seen people lose their lives to this disease. And I know for a fact that many of you have championed sickle cell for so long, and you have done so much to bring progress in this space, and you should all be proud of yourself. And that's something, honestly, I feel you should all brag about. Because of your policies over the years, people with sickle cell are now living longer. And we now have multiple therapies on the market after going decades with just one drug for our patient community. And now more than ever, we are so much more closer to a cure for people living with sickle cell disease. And so from the bottom of my heart, I want to say thank you to all of you for all that you've done and all that you're going to continue to do to ensure that my daughters are going to live out their dreams and that all people living with sickle cell are going to have improved lives. I want to thank you so much for your time.
Thank you so much, Sister Dawn, for that incredibly important discussion of what it is like to be a mother of sickle cell children and helping us all figure out how we can be better advocates on the state and federal level for dealing with sickle cell disease, particularly with that human touch of what it is like to deal with sickle cell patients on a very, very individual level. As we think about becoming advocates for sickle cell and moving our good intentions to the action side, it's extraordinarily important, as it is with any medical situation, that we think about test cases and examine use cases. Well, we have with us two healthcare experts, but more importantly, healthcare advocacy experts who have very deep and very intimate experience in advocating for sickle cell policy advancement. So we will bring to you now, first of all, Mary Brown, the CEO of the Sickle Disease Foundation. She's based in California, as well as Dr. Diane Nugent. She's the chief of hematology at Children's Hospital and the founder of the Center for Inherited Blood Disorders in Orange, California. Ms. Brown, CEO Brown of the Sickle Cell Disease Foundation, and Diane Nugent, Dr. Nugent, are going to talk about the California experience. So examining what they did to become effective advocates against sickle cell, effective advocates in front of governments to help fund, to help curb the spread of sickle cell in one of our most populous and so important states. Dr. Nugent, CEO Brown, the floor is yours, and thank you for joining us today.
Thank you so much, and thank you for the opportunity to share our experience and give a loud, proud shout out for our state legislatures who helped make this happen. I'm going to turn it over to Mary to open this up.
Thank you, Dr. Nugent. I'd like to thank you all for the opportunity again to bring the California experience. Our previous presenter spoke of the advocacy, and I think all of our work is that to be advocates in this space for sickle cell disease, but we cannot do it alone. We need your help and we need your voices along with ours. So as we go through this presentation, I hope you'll see that California has done a few things that are a little different, but we think will bring life and quality of health to persons with sickle cell disease. Dr. Nugent, you want to take it from here?
Yeah, Mary and I practice this back and forth and have presented it in front of our legislators many times, but I think it's really important just to quickly remind everybody that at least 100,000 Americans in this country have sickle cell disease. 1 in 12 Black Americans have sickle trait, something that the majority of them aren't even aware of. We have one of the shortest life expectancies for sickle cell in California. I want to stress, and Ms. Dahl did a great job of talking about the impact, not only medical impact, but psychosocial and environmental community impact of sickle cell. And when we think about the importance of really making a difference with a disease that isn't just about pain, and it's not just about anemia, those are the superficial findings, as Ms. Dahl knows, of an underlying silent organ failure that if it's not addressed, if we don't take care of patients, they will not have a normal life expectancy. The quality of life will be bad. But the flip side of that coin is if they can get to good care, if they can get to good preventive comprehensive care, what Ms. Dahl talked about for her children is 100% true. Life expectancy in England, where they have a formal and well-organized system, is 71 years. And the quality of that life is excellent. So we need to have pay attention to the fact that we're doing a terrible job with this chronic complex disease. And I want to respond to what Ms. Dahl said, that this, she was concerned that people didn't want to advocate for sickle cell. Sickle cell is the leader in demonstrating to our country what we can do with chronic complex disease of any kind. And I think the success that we're having in California should have a ripple effect. So once again, I think that the leadership on this call has an opportunity to really impact healthcare. Certainly sickle cell, which is much needed, but think about the effect it'll have on other chronic complex disease. As an example, down at the bottom of this slide, you see 100,000 individuals with sickle cell. Hemophilia only has 33,000. And yet in our country, there are 130 hemophilia treatment centers. The percent of patients with Medi-Cal managed care, or excuse me, Medicare, Medicaid, 70% in sickle cell, it's only 32% in hemophilia. So how can we start to change this? Why not have a network like hemophilia across our country? Mary and others on this call have done an incredible job to demonstrate that we only need about 128 centers across to meet the needs for our 100,000 patients. But the important thing, and please take this home with you from this talk today, is we cannot have any success as physicians and medical providers alone. What we have in California is a 100% partnership with our community, in this case, with the Sickle Cell Foundation, their work in mental health, in community services, and also, really importantly, community health workers. These individuals have been integrated into our clinics so that now we're beginning to see the success that the community can't do alone and healthcare can't do alone. Has to be 100% partnership. Mary?
We devised a program called Networking California for Sickle Cell Care. It is comprehensive care for adults. It is transitioning those pediatric patients to adult sickle cell centers. It provides multidisciplinary, team-based preventative care and treatment in full partnership with the community and other services. And I will say here that the key to the success thus far in our network is that we are able to provide knowledgeable, and I'm going to say it again, knowledgeable treaters that take care of individuals with sickle cell disease. What we've heard most in anything that we've done is that my doctor doesn't know anything about sickle cell disease. And so thus far, we have been able to pull together a team, and sometimes doctors that were already there treating patients with sickle cell disease that we didn't even know about. We've been able to identify them and bring them to within the network and provide them with other services that they were not getting from anywhere else in their practice. Next slide, Dr. Nugent. So how did we know all about this? Well, I think earlier, as our moderator said, we've been doing a whole lot of meeting and a whole lot of talking. In sickle cell disease, we've already known what these problems have been for decades. They haven't changed. We know that there are few providers that understand sickle cell disease. We know that there are individuals with sickle cell disease that are treated as drug addicts when they go into the emergency room. We know the healthcare system doesn't provide the kind of care that we believe our families need, sickle cell disease or not. We know all of these things, but at some given point in time, and I'm getting old, I wanted to make sure that before I left this space, that we did something. So there became a call to action from me within myself, a call to action with Dr. Nugent, a call to action within our state. And as a part of a grant that we have from HRSA, we were bound to pull together a stakeholders meeting in Sacramento. And we did that in 2018. And that was the beginning of what we knew to take to action. And again, everything that came out of that stakeholders meeting in 2018 was no new news. It was the same presentations, it was the same information, but now what do we do with that? Dr. Nugent?
Yeah, one of the overriding themes that came out of that is that it was clear in California that there were no adult centers with expertise in sickle cell comprehensive multidisciplinary care. And again, this talks about attention to all aspects of sickle cell disease: silent strokes, silent progressive heart failure, loss of lung, kidney loss, bone loss. That's the silent killer in sickle cell. It's not this concept of just people being anemic, being drug addicts, going to the emergency room is so wrong. And Mary and I really have tried hard to begin to help people understand and try and conceive. If you were an individual with a complex chronic disease who had been cared for well as a child, but then transitioned to adulthood and there's nobody to take care of you that knows what they're doing, it's up to you to get coverage for your pain in an emergency room, to get help and go to a hospital. You don't get continuity of care there. Pick a complex disease, diabetes, heart disease, any of those. Imagine not having any treaters. Imagine having to take care of that yourself. And that's what sickle cell disease is in California, or was 3 years ago. And that's why we felt that it was an emergency. And as Elliot said, Dr. Vichinsky, who was part of this program, people are dying because there's just no healthcare infrastructure, no specialists, primarily because there's no way to reimburse teams of people taking care of sickle cell. There were few adult centers, there was no transition, and a huge lack of knowledge. Now, it's not that the state wasn't paying a boatload of money for sickle cell. Back in 2014, when we had data on 6,000 adults in California, actually that's the total number of sickle cell patients in California, the state was paying per year $738 million. We now know from tracking California CDC data that we have 9,000 patients, 6,000 adults, and the annual cost to California is over $1 billion. So we decided, Mary and our organization went to advocate, and Mary's going to talk about that in a moment, but we knew we needed to build capacity, not brick and mortar clinics, but we had to establish places where adults could go. We needed to build the workforce. We needed to include surveillance and data to show that what we're doing is making a difference. And we needed to put funding into outreach and education. Mary?
So all of you on the call here today have a very special place in our communities. And I think it's important for us to recognize that when one of you, all of you, or all of us get behind a cause, we can make a change. In late 2018 and early 2019, we started talking about what can we do on behalf of patients with sickle cell disease in the state of California. And we met our champion, Assemblymember Mike Gibson. But Mike wasn't alone in his carrying of the water for sickle cell disease. I have to also recognize Dr. Shirley Weber, have to recognize State Senator Steve Bradford, and the full California Black Caucus, who took this on as an initiative that needed to be taken care of and introduced. This was something that, again, was very important. And we, as the community, myself leading the community, Dr. Nugent leading the clinical teams, we could not do this without the California Black Caucus, without Mike Gibson, without Ted Love, who also was a part of the work that we were doing in California to move this initiative forward. And in June of 2019, as part of the governor's budget, $15 million was awarded for us to begin to develop the infrastructure for Networking California for sickle cell care that we so call today in the NCSCC. It took a lot of work. To advocate for these funds was not for the weak of heart. Diane and I don't live, or at the time did not live in Sacramento. I still don't live in Sacramento. She's closer to Sacramento, but we were in Sacramento 3 or 4 times a month, meeting with all of the individuals that we should have to educate and bring awareness of this disease to our state legislators. The thing that was very important for us is that we always got a very positive reception. We never got anyone who was not interested in listening to us. And that was important. We came in with the patient voice, the patient perspective was part of the team, the clinical perspective was part of the team, policy was part of the team, and then community. So we came in loaded to bear to educate our elected officials about sickle cell disease. And I would be remiss right now if I did not recognize Mr. Tony Gonzalez, who's a representative, a lobbyist, I should say, in California, that heard our call and heard our care and took on our initiative as a pro bono effort to the sickle cell community. So we are eternally grateful for the Black Caucus, for Representative Gibson, and for Tony Gonzalez to help us get through California. Dr. Nugent.
I'm going to close. I'm aware of the time. I just want to let you know what we've done in the last 34 months. We've gone from 0, and these are the areas where we knew we had the highest percentage of adults with sickle cell, to now actually we're up to just over 10 clinics. We've got 27 hematologists, family medicine, med peds practitioners, and physician assistants. Particularly of concern that 2/3 of the patients with sickle cell were in the southern part of the state. And we've been able to meet their needs with opening up these clinics. We've just really taken the last 30 months to get everything in place, and the patients are starting to come in now. Mary also advocated and received an additional $1.5 million, which included behavioral health, which we recognized right away was needed. We've spent dollars on data collection. This is very important to get the data from our community health workers, which is so critical to the success of these clinics. We're also getting important data from our medical facilities, but included, and I just want to make sure that everyone knows the patient voice is critical. And so it's not just what we're doing, we're partnering with the patients to make these clinics work for them. And it's beginning to scale up nicely. We're getting all of that data. I'll close by saying in the first 12 months, we had 38 patients that the CDC, not our data, but the CDC could look at pre and post clinic. And we're already seeing a trend down in the number of inpatient stays. The length of those stays has been cut in half, and the emergency room encounters are less. We realized $1 million saving to the state just on those 38 patients. We estimate that we would save over $1 million for every 2,500 adults with sickle cell. There are over 4,000, as I said, in California. So I'll just close by saying we have to develop a sustainable model. And what we mean by that is only 20% of the dollars that we would save would support the whole network going forward, and not just to provide care, but to provide quality of life, improved community participation, going to school, going to work. It's really critically important. And so we're hoping this year we'll get an additional 3 years of funding to continue this work. We're praying, and I hope you all do as well, that the governor will sign off this budget for us. And I'm hoping and praying that we can make this a national network to address chronic complex disease, because Ms. Dahl said it best. We want all of these kids to grow up and have normal lives, to be able to have families, to be contributing members of our community with all their gifts. It's really important. Thank you so much for your time and attention.
Wow, that was fantastic. Thank you so much, CEO Brown and Dr. Nugent, for explaining the California experience, for laying the case. Look, everybody here, I see a lot of staffers here, a lot of legislators here. Let's be very clear. What they just laid out in terms of building capacity, building workforce, and ultimately building infrastructure to fight sickle cell disease is a big lift. But it's going to take all of us. And I can't imagine, when you look at the data that they presented about extending life expectancy from 41 years to an average American life expectancy somewhere in the neighborhood of 71 years for African Americans afflicted with sickle cell disease, I couldn't imagine a more worthwhile task. Shout out to my good brother, Mike Gibson. I see you with the very sharp bow tie. Thank you for being a champion in such an important state such as California. I am going to get to Representative Frazier and the rest of our elected officials who are going to be champions in their states soon. But I must say that when my mentor and friend, the gentleman from South Carolina, our esteemed Democratic leader, House Majority, and hopefully eternally Majority Whip, I'm sorry, we're supposed to be nonpartisan here, but he's our guy. So when the Majority Whip comes in the room, we pause and acknowledge him and allow him to present, and we will get to the balance of the program after that. So I pause to introduce the distinguished gentleman from South Carolina, our dear friend and great champion of eradicating sickle cell, James Enos Clyburn. The floor is yours, sir.
Thank you very much, guy. Well, I see you've looked at my birth certificate. Most people don't know what that E stands for. And I want to thank you so much for introducing me here today. But buddy, I feel a bit slighted because when you're around and there's a camera in front of you, you're supposed to have on some HBCU
I am.
for a shirt, and being a South Carolina State guy, I thought sure you'd be greeting me with the South Carolina State sweater today. But I'm going my way down to Florida this weekend on Saturday. I'll be at Bethune-Cookman for their commencement. And on Sunday, I'll be at Morehouse College for theirs. So if you just keep wearing your HBCU thing, it's going to be hard for you to miss me.
Yes, sir. I got you.
But thank you so much. Thank you for all that you do. I want to particularly thank the president of the National Black Caucus of State Legislators, Bill Mitchell, from the southern, a little south of me down there in Georgia, for his leadership of this group. Thank him so much for what I know he can do to help take us to a different, another height. I'm hearing static here. I hope you can hear me all right. And secondly, I want to thank Molly Ryan for inviting me to be a part of this today. She's getting to be a real habit. Over the last several days, we've seen each other several times. We thank her so much for her friendship and for her commitment to global blood therapeutics. I'm particularly interested in sickle cell for several reasons. Those of you who are aware of my efforts on behalf of high school graduates trying to get off to college, my biggest fundraiser on their behalf that in the last several years has given 175 scholarships to high school graduates is the Rudolph Kanzeda Memorial Golf Tournament. We hold that tournament every year, the first weekend in August. And it's named for a young man who was young at the time he died, Rudolph Kanzada, who died at the age of 49 of a ruptured aorta. He first got me involved in the sickle cell battle because of his daughter, Peaches, who had sickle cell. And I saw the battles that she had, and to hear that the research that is taking place is now increasing life for people with sickle cell disease to be over 70. That is music to my ears, because Peaches died at a very young age. And I saw what he and she went through with her episodes. And so I know the importance of this. In other diseases as well. My mother died at a very young age of multiple myeloma. And at the time she was diagnosed, the science was of such, we were told by the doctors that she only had 8 months to live, and she missed it by 2 days. But today, I know people with multiple myeloma that's living far beyond that because of the research. And so the resources that you are pushing for, I want all of you to know, you aren't gonna have any problems with me. You know, I get a lot of flack from people sometimes, but they see the support that I get from the pharmaceutical industry, and they immediately think it has something to do with my votes in because of whatever their interests might be. No, I am committed to doing the investments that need to be done in the research that need to be done so that we can conquer as many diseases as we possibly can, so that we can have people with sickle cell getting a better quality of life. In fact, down at Medical University of South Carolina, their research facility was named in my honor years ago because of the commitment we've made to get as much federal dollars as we can into the research. When I first got elected 30 years ago, South Carolina led the nation in amputations because of the late detection of diabetes. And we went to work to change that, and that has changed. That's a title we no longer have. And as many of you know, I lost my wife to diabetes 2.5 years ago, but because of the research, she lived well beyond the promise, rather than what would have happened when her father died with diabetes. He was a double amputee. But because of this research, Emily had all her limbs when she passed away. So I'm committed to the sickle cell research. I'm committed to the James R. Clark Sickle Cell Anemia Foundation there in Columbia, and the sickle cell facility up in, I think up in Greenville, Spartanburg, Boxdale Center. I'm committed to it. So I'm committed to your work. Molly, thank you so much for your friendship. Thank you so much for the intelligence that you tend to pour into me, so that I am equipped with the knowledge that I need in order to carry your arguments to the floor of the House in some of the committees. Just know full well, I can sit here and talk to you about the numbers and how many people are sick with this disease and how many are expected to pass away because of it, that won't get us anywhere. Anybody can regurgitate those numbers. What's going to take it for us to get where we need to be is a commitment to getting the resources you need in order to fund these programs, and the increase in funding that you're seeking. Just know that I'm committed to it. I'm also committed to doing what I can to get at least 217 other people in the House to agree with us. So thank you all so much for having me. And thank you again, Brother Mitchell, for your leadership. And Molly, I look forward to seeing you again real soon. Don't make it tomorrow.
Thank you so much, Leader Clyburn. Again, this is not just a meeting. This is an advocacy session. So it's important to reiterate what we just heard. We just heard that we have an open door at the highest level of the United States Congress. So we're going to hear from more of our state legislators about how to push the agenda in their states, and maybe even some mayors can take up the cause locally. We're going to hear from more of our state legislators as we go. But we just heard from the tops of the United States Congress that we as a coalition to fight sickle cell have their ear to pursue funding and to pursue the building of infrastructure. And I might believe that history tells us that he has the door of the gentleman at 1600 Pennsylvania Avenue. Never forget the 2020 South Carolina primary and why it went the way it went. And now that Mr. Clyburn remains at the leadership of Congress, he also has a very, very clear presence at the White House. So we thank you, sir, for your championing not only sickle cell eradication, but eradication of all chronic diseases that afflict our people to an unhealthy and unprecedented degree. Thank you so much for joining us, Mr. Clyburn.
Thank you very much, Don. I look forward to seeing you soon. And I'm not kidding about that HBCU stuff.
South Carolina State on Sunday, sir. I got you.
All right, Don.
All right. It is appropriate that we remain in the South. We have with us a lifelong public servant who happens to be a daughter of the American South, Representative Gloria Frazier, a native of Shreveport, Louisiana, spent time in the Dallas, Texas area, and since 2007 has represented the Georgia's 126th House District, the Augusta metropolitan area and surrounding counties. She's going to talk to us about the action plan in Georgia. You take it away, Representative Frazier.
Thank you, Don, for your wit and enthusiasm today. You really keeping us going. Now, I am actually going to do mine a little quickly because I had to yield some of my time respectfully to Whip Clyburn. And that's okay. I am very, very happy to be on this webinar with these awesome presenters, my NBCSL president, President Billy Mitchell from the great state of Georgia. I represent the Augusta area, home of James Brown, and I am so honored to thank, first of all, Molly from GBT for even having this webinar to get this education out about the importance of sickle cell and how we need to step up and address and deal with this debilitating disease that has crippled so many of our Americans that want a quality of life, a better quality of life. And we have been really slow in the process of helping folks that live with this dreadful disease, and now we're stepping up. So I'm very, very proud to be a part of this. I took this task on in 2007 when I was first elected, and not knowing that 16 years later, I would still be trying to find funding and trying to educate folks to understand the importance. Here in Georgia, we have over 7,000 noted cases of sickle cell that we know of. We have hundreds of people that have the sickle cell trait. I did not even know I carried the sickle cell trait till I started helping with sickle cell, and my sickle cell foundation actually tested me, and I found out I carried the trait also. So there's hundreds of thousands of us that carry this trait, and we might not ever experience a crisis. So it's very, very important that we educate ourselves about it. Here in Georgia, we passed in 2015 the Haley's Hope Act. That is a young lady, a very young child that had over 100 seizures a day. And Representative Alan Peake from Macon, Georgia, actually carried that legislation for 2 years prior to help this young lady deal with her seizures. And the only thing that would help her was the cannabidiol. But it was illegal here to get it. So many folks had to travel to different states to get this. So here, fast forwarded to 4 years later, we finally approved a bill for medical pot cultivation here for cannabidiol and the sales of it here in Georgia. So we formed that 7-member commission and we got that done. And so we're gonna fast forward it another to 2021. And even the last session we just finished in April, where we were actually getting ready to issue 6 licenses, I believe, and it passed out of the House, but it failed in the Senate. And so we'll be coming back next session, hopefully, to pass that law, but we can cultivate it right here so folks can be able to get the oil that they need to help with not just sickle cell, but all of the cancers and all the pre-existing diseases. I was very fortunate to be able to add sickle cell as one of the diseases that was put on that bill back in 2015, so that my folks can also have access to the cannabidiol oil that they need to help them with pain. So that's where we are. The health disparities here in Georgia are the same as they are across the United States. We need to expand Medicaid. We need to have access to hospitals. I was fortunate enough to be able to work with several of my legislators. My right-hand man is Representative Al Williams from Midway, Georgia. He works with me in trying to get our funding every year. Hopefully we can get new leadership in place and I can get a substantial amount of funding like California has for the state here in Georgia. So I am so honored to be here. Thank you, Global, for doing this webinar and educating us about where we need to be across the United States. And I am here to support you. And thank you for partnering with the NBCSL. And we're collectively together, we can make a difference in the lives of folks that live with sickle cell disease. Thank you.
Thank you so much, Representative Frazier. It's telling me that I can't start my video, but I'll just, Representative Frazier, perhaps I should not have snitched on you and said you were from Shreveport, because now you got folks looking for you. Shout out to, in our comments here, Rosalind Spain, Executive Director of the Sickle Cell, Executive Director of the Sickle Chapter. I don't think that's right, but she's doing the good Lord's work on sickle cell in Louisiana, in Shreveport, and she says hello from Rosalind Spain. I will say, for all of y'all, we're watching the chat. We're going to get to y'all the follow-up materials that folks are requesting. So please, all of y'all advocates and friends and representatives and electives and just important folk, please continue to use the chat. Staff is watching it, and we will get these materials back to you right away. Thank you so much, Representative, for joining us from Augusta. Our next representative, also a Southerner, also a fantastic HBCU grad, 1996, Texas Southern University. We're going to hear from the man with a fabulously gray beard, Representative Jarvis Johnson. We know that there is excellence attached to the seat that he has, that he currently holds in Houston, Texas, because he succeeded the dynamic mayor of Houston, Mayor Sylvester Turner. Representative Johnson, please bless us this afternoon. Good to hear from you, brother.
Brother Calloway, thank you so much for being a fantastic moderator and keeping it moving. It's such a pleasure to be here. Certainly, anytime I'm in the same Zoom or in the same room with Dr. Frazier, Dr. Gloria Frazier, I know I'm in the right place. So I'm gonna be quick because I'd already been admonished. I'm not gonna tell her that she went 3 minutes and 30 seconds too long, but I'm not gonna mention that at all today. But it is certainly a pleasure to be a part of this anytime we get to talk about sickle cell, to bring it to the forefront of the conversation here in America. I think it's so very important because it has been pushed down for so long. And so I have to all credit and kudos and go to Dr. Love and GBT and the wonderful work that they have done to bring this to the forefront of America's eyes. Over the last 3 sessions, I have pushed for legislation to help people who are afflicted with sickle cell, to tear down the walls of misinformation, and certainly to bring what I believe to bring humanity to many of the people who have to go to hospitals and who are treated inhumanely. And so over the last few sessions, we have passed several sickle cell bills. In particular, we established a sickle cell task force to deal with some of the ailments and the issues and the stigma that goes along with it. We passed a bill to ensure that our doctors here in the state of Texas will not feel the fear of administering or prescribing opioids to people who are afflicted with sickle cell. We've also designated September as Sickle Cell Awareness Month. And then we also were able to create a license plate that would help us not only raise awareness, but raise money for organizations that are trying to do the work that they are doing here in the state of Texas. And then lastly, last session, we worked diligently to create a registry to make sure that through this registry that we could find out, because Texas has over 7,200 people who are afflicted with sickle cell. I happen to believe that number to be greater than that, but I think it's important that we know the numbers so that it can help us as we are trying to find not only the dollars, but find the people who need the service. And so I introduced the bill of 3673 in the state of Texas to deal with the sickle cell epidemic and to make sure that we could find out who's out there. And unfortunately, we passed it in the House, but it's something about that Senate. I don't know. It's something about the Senate in all of our states and then in this country. In order to be a senator, you have to be something else. And so we were not able to pass it in the Senate, but I truly believe that in the next session, we will be very successful in bringing about this registry. Because we understand what this registry does. Obviously, the registry offers the opportunity to get more information about this disease and to draw a real picture of what's happening and to make sure that the healthcare industry understands it. And so, because unfortunately, in 2022, the healthcare industry still does not understand what sickle cell is and how it is affecting many of the people that it affects. And so we're going to continue to fight to have this registry, to continue to make sure that we cut down on the disparities that we understand is happening in the medicine, in the medical field. And I think that's certainly unfortunate that in 2022 that you still have medical disparities in how you treat patients who are coming in for simple for ailments. And so we're going to continue to work that, continue to work hard. And I'm certainly ecstatic the fact that we have GBT and other organizations that are working hard on this and bringing awareness. And I think we'll be successful in the next session. So with that, I will put a pin right there. And if there's something, now you're going to pull that up. Now you're going to pull that up. I'm sitting here going through this whole thing about memory, and now you're going to pull that up. I thought I did everything I could. Dr. Frazier, I'm done. I'm not going to let him go back through it. You can quickly go through it, Brother Calloway, to show all the things that I said. I have to give credit to Andre Harris, who worked in my office, a young man who worked in my office, who was afflicted with sickle cell and helped me get many of these bills out. Tanya Prince, who bent my ear more than I probably should have allowed, but I'm so glad that I've allowed her, who was a part of Sickle Cell of Houston, and many others who have been very supportive and helpful in making me understand what this is all about and what this ailment is all about. So, yeah, well, you can read as we you can read what I tried to go through. So what I will put a pin right there, Brother Calloway. Yes, I am a HBCU graduate. So when you tell Dr. Clyburn, yeah, I'm HBCU down, and we're gonna fight hard for HBCUs in this state and in this country in the next session as well. because we understand how there's been a disparity in education funding for our HBCUs.
Thank you so much, Representative Johnson. Now, shout out to your staffer who put together them slides. I know you didn't do it. Even though they didn't get shown, we appreciate the efforts and we appreciate our team for eventually putting them up. And thank you. We will disseminate all of our presentation materials to the assembled. I hope y'all didn't miss something, because the gentleman from Houston said something extraordinarily important. And he was lightweight joking, but it's something extraordinarily important. When you consider African-American representation, elected representation throughout this country, particularly in the state legislatures, we are primarily in the state houses. And those are, as we know, as legislative processes, as the Canadians say, processes go, the state houses are often the lower chamber. So this is about coalition building. If we are going to build the infrastructure and build the workforce, build the capacity to eradicate sickle cell, we have to find champions in the upper chamber, in the Senate. First of all, we've got to get good brothers and good sisters like Representative Frazier and Representative Johnson elected to that higher chamber. That's a part of this. But this also cannot be vested simply in the state houses. We have got to find allies and advocates in the state Senate. Make this a campaign issue. Make your state senators and those who are aspiring to the higher chamber talk about sickle cell disease on the stump. Make them talk about it with donors. Make the issue a priority with the state Senate, where we don't have the numbers of African Americans in elected capacities as much as we do. So thank you so much, Brother Johnson, for everything you've done to force the issue in Texas, and that Senate will catch on. We have faith that they will. Speaking of faith, the next elected representative to join us is the pastor of the Lee Chapel AME Church in Nashville. It's important to note that it's in Nashville because this brother is a two-time HBCU graduate of the illustrious Tennessee State University as both his undergraduate degree and his doctorate degree, but in between went to the Vanderbilt University for his Master's of Theological Studies, also in Nashville. If you know about Tennessee, you know that the state capital is also in Nashville. So just by my count, and listen, I'm not ascribing no opinion to this, but we got undergrad, Master's in Theological Studies, church, and PhD all in Nashville. I'm just saying there's no clear evidence that this brother has ever left not only the state of Tennessee, but the city of Nashville. So he is a true Nashvilleian, a true son of his city, and the city should be extraordinarily proud of everything that the gentleman from the 58th district is doing, not only for the state of Tennessee, but specifically for the city of Nashville, which it is not clear that he has ever left. So with no further ado, I was trained properly, so I'm gonna make sure I get these titles right. With no further ado, I bring to you all to discuss what he's doing in Tennessee, the Reverend Dr. Representative Harold Love Jr. of Tennessee.
Thank you so much, Don, for the introduction. I really do appreciate the highlight of the bio. Certainly to GBT and to NBCSL, thank you for putting together this seminar on sickle cell disease. In the interest of time, just want to highlight two pieces of legislation that I was able to sponsor and get passed and signed into law. In 2015, we discovered that we had an opportunity to put sickle cell disease treatment on the list of reimbursable treatments that people on TennCare, which is our Medicaid program, would be able to utilize, because what we found was many of the doctors were not able to treat the patients or have office visits outside the emergency room, which of course caused patients to not be able to see their doctors on a regular basis, and then had only emergency room visits. So 2015, we passed that piece of legislation. It is now current law, which again allows TennCare patients to be able to visit their doctors in their doctor's offices and get treatments and procedures done to keep them from having the disease be exacerbated. Then in 2016, my wife's cousin, Terrence Perry, died. He had sickle cell disease. Because of his disease, we really became very acquainted with the impact of sickle cell disease, not just in our family, but in other families across the state and the country. One problem we discovered was, of course, there are health disparities in research and care and treatment for all diseases affecting African Americans, but particularly sickle cell disease. Out of this conversation with family and friends, was able to propose legislation in 2021, which now requires our TennCare program to conduct an annual report and produce that report and provide it to the General Assembly that takes into account all current and possible future treatments of sickle cell disease that persons can make themselves available to use. Why is this important? It's important because if our TennCare program is not focused on the possibility of a new treatment being out there, then when patients and families are trying to get TennCare to cover these treatments, they're not going to cover them. So this legislation, which is now law, again, allows an annual report to be produced, reported to us, which includes input from stakeholders like the general public, but also pharmaceutical companies and all stakeholders who are aware of new treatments for sickle cell disease. And this is what President Billy Mitchell made reference to earlier, that in Kentucky, the law has been passed, and also Senator Barrow in Louisiana is also, I think, carrying the legislation. Now, the legislation in Tennessee is called Terrence's Law, and that's to tribute to our cousin, Terrence Perry. So with that, I'll conclude my presentation. Again, once again, thank you for the wonderful opportunity to present to you about sickle cell treatments and advances in the state of Tennessee.
Thank you so much, Reverend Dr. Representative Pastor, Nashville's own Dr. Love. That is a man who does a lot of television right there. His lighting is perfect. He's got the flag set up. Salute. The proper dimple on the Windsor knot. I see you, Representative. Well done, Pastor. Well done.
Thank you.
I know we're tight on time here, and it's important that we hear from this next gentleman from Michigan. Representative Ronnie Peterson represents Lansing in Michigan's 54th district, has been a county level, local level legislator from Washtenaw County, currently represents Ypsilanti. It's important for this discussion that we point out that Representative Peterson is a master appropriator. And we have had a lot of conversation on both the federal and the state side about drawing down funds to build the infrastructure, the medical infrastructure and capacity to eradicate sickle cell. Hopefully, Representative Peterson, I don't want to hijack your presentation, but talk about this a little bit from the perspective of being an appropriator, as we know these funds to fight sickle cell are going to be so crucial. So with no further ado, the gentleman from Michigan, Representative Ronnie Peterson.
Thank you. First of all, I want to thank you, and thank you for allowing me to be on the program. And you're an excellent moderator and host. And certainly I appreciate you. Let me just also, to all the rest of the panel, my hat is off to you for the excellent work you do throughout the country. And certainly I appreciate this opportunity to always join you. Let me just point out a little bit about how the work began to take a look at sickle cell and sickle cell funding. We took an aim at the sickle cell license plate, the need for a sickle cell license plate. One is for the purpose of awareness, the other one for the purpose of raising money for the Sickle Cell Foundation in Michigan, to give them an ongoing revenue stream, to have dollars that they can do to make awareness, as well as other avenues of possible treatment dollars could be possibly available without going directly to state appropriation. We were successful in passing that bipartisan piece of legislation, and we're moving forward for that plate to appear this year. I must stop and recognize the Michigan Foundation chair, and let me say the foundation chair, the board, and also Dr. Sherney for the work she do. Dr. Wanda does so much work here in Michigan to make sickle cell awareness, but also the advocacy work that the foundation does is incredible. And I think that is one of the driving factors of the success of our legislation. Let me also recognize the fact of State Senator Sylvia Santana and the work she have done in the Senate, Michigan Senate, to help me navigate through the final passage of much of the legislation for appropriation for sickle cell treatment dollars to be available here in Michigan. We started working with the plate and then went on to request the governor's engagement and involvement. We were successful in the last appropriation in securing $6.7 million from 21 to 22 budget for the expansion of medical coverage to include uninsured and underinsured adults with sickle cell disease. We also began to work on another project that would saw the need for additional treatment centers here in Michigan, only relying greatly a deal on one major hospital in southeastern Michigan, one in the Flint area, and one in Ann Arbor. to be a provider for care. We work with the Michigan Sickle Cell Foundation, identified a need for a clinic within the greater Detroit community. And I want to say once again, the Michigan Foundation stepped up and helped us navigate through the process. We were able to secure some additional dollars, $750,000 new dollars for an enhancement grant from the state of Michigan to enhance that possibility of that clinic. We are also approaching, let me say, with an additional request for appropriation of $2.25 million for an additional funding for that clinic this year. So that's additionally, it'll be about almost $3 million in additional. But I've got to point out the fact that Wayne County Executive Warren Evans, for the excellent leadership he has provided and coming to our support. We asked him to reach out from Wayne County, the largest county in the state of Michigan, for support. His father was a practicing physician and Warren understands sickle cell. And he wanted to be a part of this action plan that we have put in place to bring about a clinic here in southeastern Michigan, and has played a personal pledge from the organization of his team of staff support, of his, let me say, most capable health administrator and director, who's doing a great job of helping us put that plan together. Let me also point out the fact that those dollars he had pledged, without letting him make the announcement later on sometime this summer, has been a tremendous boost to us in making that accomplishment possible. I cannot give as much thanks that time would allow me for Dr. Wanda Sherney and for her work that she's doing with the association, as well as here in Michigan chapter, but also to the, throughout the state of Michigan, not just southeastern Michigan, let me point that out, but throughout the state of Michigan, the work her father and she have done to make a difference. But let me just say this, and I want to make sure it's clear. It takes a partnership to make this happen. And it takes a commitment from dedicated legislators who wants to learn what happens in terms of sickle cell, but also the commitment to see it through without any bending or any bowing, but stay stern and firm. Thank you for this opportunity to be with you. And I look forward to working with you all in the future. Appreciate all what you contribute to the enlighten me of what you're doing in your various states. Thank you.
Thank you so much, Representative Peterson, for joining us. If you're anything like me, one of my great joys is to hear and witness expertise. And what we just heard, ladies and gentlemen, is an expert legislator, particularly in the universe of appropriations. So as you go into your advocacy plan and put it into action in your state, as you become a champion of eradicating sickle cell in your state legislature, make sure you get an appropriator on your team. They know how to draw down the resources, and I'm going to volunteer you. If you don't know what to do, ask Representative Peterson of Michigan. Thank you so much, gentlemen, for everything you've contributed here today. I'm going to get to our last guest, who is not going to join us on video, but will give us some remarks. The sponsor and host of this afternoon's activities, Dr. Ted W. Love, who has had a dynamic and fantastic career, both as a physician caregiver, but also as a medical innovator, someone who is well-versed in the business of healthcare and healthcare delivery, the president and CEO of our host organization, Global Blood Therapeutics, who has done so much work to advance the cause of eradicating sickle cell. With no further ado, Dr. Ted W. Love.
Well, Don, I want to get started by thanking you. I don't think I'm going to do another event unless you are the moderator. You are very good at this, man. I could not start without first thanking Molly Ryan. Molly is our Vice President of Government Affairs at GBT, and Molly has done things and made connections with all you great leaders in a way that I never imagined. So thank you, Molly, for everything you've done. I also have got to thank Representative Billy Mitchell, the NBCSL Executive Committee, for your work in doing this and allowing me to be here with you today. I want to recognize all the amazing dignitaries that you've heard from today. Many of you, like Gloria and Representative Johnson, good to see you. And the others, I'm looking forward to getting to know all of you very well, very much as well. And then, of course, I really want to thank all of the SCD leaders and the SCD warriors. We could not do this without you, and of course, you inspire us. This is a very special community, and GBT, and I can tell you, Ted Love personally is just so proud to be part of this community. I'm going to end by really just giving you a sense of GBT, and it's going to be a conversation, and what GBT is about. So many of you know I came out of retirement because I knew that a group was going to fund starting a company to focus on sickle cell disease. And when I was in medical school, I saw sickle cell care, and I was very embarrassed and angry, quite frankly, at how I saw the sickle cell patients treated. And so when the opportunity came along to build a company that would focus on eradicating sickle cell, I raised my hand, and I am just so happy that I did it. On the next slide, just want to give you a sense of our mission. Our company really exists to end the pain and suffering of sickle cell disease. We do that by focusing on the patient. This slide contains a picture of Muiwa. He's a gentleman that was in our first clinical trial for approval. Muiwa called me and said he didn't know if he was on placebo or real drug, but he felt so good that he wanted to be on whatever it was the rest of his life. He was, of course, on real drug, and he remains on real drug. So thank you, Muiwa, for being a participant in our clinical study. Want to talk just quickly about sickle cell disease. We've already heard this is a very serious problem. It actually affects millions of people around the world, about 100,000 in the US, but millions around the world. We need to fix that. It has had historically limited treatment options. I think it's largely because the people are brown and Black. The devastating outcome that I'm focused on is 30 years life expectancy. Representative Clyburn mentioned how people with myeloma are now living longer. That's in part because of work that people in our industry did. I can take a little bit of credit. One of the most recent drugs approved for myeloma was a drug that I worked on and got approved with the FDA through accelerated approval. It's being widely utilized, and it's dramatically changing the outcomes. So we've got to change sickle cell. It's a disease which has all these things mentioned on the slide, from cognitive issues to stroke to premature death. We think we can solve all this, quite frankly, with the once daily pill. We've already got a therapy out there that's highly effective. Mupilla, I know you wouldn't mind me saying that 2 of your lovely daughters are on the therapy, and I'm just thrilled to hear about the benefit every time we talk that they're enjoying. Now, just to give you a perspective, our industry, the pharmaceutical industry, has obviously a desire to be successful. We have to make sure that we reward our investors in our company. We had a problem of not making drugs for rare diseases in this country because there just weren't enough patients to make a return on the roughly $1 billion that it might take to make a drug. So we passed in 1988 the Orphan Drug Act. And what you can see here in blue bars is that that act worked. These are approvals of drugs for rare diseases, but it didn't work for sickle cell. We got a drug for sickle cell, but it wasn't a new drug. It was an old cancer drug that we repurposed for sickle cell. It's only been in the last few years that we've had some new drugs approved, but we still have physicians that won't even talk to their patients about these drugs. I spent the last couple of days arguing with a physician who has 300 patients. He will not even talk to them about the new drugs. He's just focused on using the old drugs. And we've got to change this kind of thing. We are focused on making new therapies. On the next slide, I just want to give you a sense. GBT is only a 10-year-old company. It's a very young company. We have focused on using the best, most sophisticated science, raise as much money as I need to raise. I've probably raised $2 billion so far. So spend the money, make the best therapies to really make this a well-managed chronic disease. Like Dr. Clyburn, like Representative Clyburn said, like diabetes. People don't die prematurely of diabetes anymore due to simple, generally oral therapy, sometimes subcutaneous therapy. We can do that in sickle cell disease. We can make very simple therapies, and GBT is committed to doing that, and we are doing that. We also, on the next slide, recognize that it's more than about making pills. We need to be funding, as we have done, innovative ideas for how you deliver care better. And you've heard from some of our friends and colleagues today about how we can deliver care better. We also recognize that we've got to be in the community as a company. We don't just show up to sell you something from our laboratories. We show up to help you in every way we can. And education is very important. When I was a boy growing up, I remember my father said to me, knowledge is power. We think it's important for us to be providing knowledge to sickle cell patients so that they can go in, quite frankly, and demand better care. That is going to be part of it. We need to help them as well. Next slide, I want to just raise that we are making some progress in sickle cell disease. One of the things that I think is most important is that Admiral Gerard, when he was Assistant Secretary of HHS, asked for this report on the state of sickle cell in the United States. And there were a lot of great ideas that came out of that. And we acted on that, and others are acting on that. One of the things that I'm most excited that we did on the next slide shows that we pulled together a council of SCD healthcare equity. Amazing people in this country who've already done a lot for sickle cell, who understand this disease, and they worked hard on figuring out, take this report, figure out what do we do now? We got this report, what do we really need to do to change things now for sickle cell patients? We've got tools that we're not even using in this country that can change things in sickle cell care. So this is what they said on the next slide. They said, we need to get the federal government to do what we've done for many other chronic diseases, like diabetes, like ALS, like cystic fibrosis. Specifically, we need the federal government to appropriate $535 million annually, which is not a lot of money when you look at what we've done for other diseases that are less frequent. With $535 million annually, we could fund 128 sickle cell treatment centers, like the beautiful center that's being built in Southern California that you've already heard about. Support the CBOs. We heard about One Attorney. One Attorney runs a CBO. She's always looking for money. We need to support people like Dr. Cherney. We need to reauthorize the HHS demonstration project and fund the surveillance program that's been ongoing by the CDC. We've got bipartisan support for this. Barbara Lee is pushing it, but you can see we've got other powerful people pushing it. This needs to get passed. This should have been passed a long time ago. We got to get this passed. We got to get these funds appropriated so that we can begin to deliver what we need for sickle cell. So on the next slide, this is just a picture of our company actually doing a sickle cell walk in San Francisco. We do these walks all around the country. I do them, my family does them. And again, it's just showing that we are here for these patients. We are here to support these patients and everybody trying to help these patients in every way. And as I said, I'm on the phone calling doctors in this country that treat hundreds of sickle cell patients and won't even talk to them about innovative therapies. We've got to get patients out of this kind of environment and into an environment where people are truly educated, sophisticated, and committed to providing good care. And that starts with getting this act funded. So I'm going to end by saying, thank you all. It is just heartwarming for me to be a part of this. I just could not be happier and more appreciative for everything that you all are doing.
Wow. Thank you so much, Dr. Love, for your leadership on this critical issue. I think that I appreciate so much of what you've said because you lead with recognition that it's going to take more than corporate America and corporate dollars. It's going to take a partnership. It's going to take holistic partnership. So we thank you for inviting all of the state legislatures and legislators within the confines of the NBCSL to partner with you, the world's leading SCD eradication organization, Global Blood Therapeutics. Thank you for allowing NBCSL to partner with you to eradicate this disease. You know, it doesn't take a whole lot of reflection or memory to imagine that in our lifetimes, in our American century, we have eradicated polio. In my lifetime, my personal lifetime, we have not eradicated, but we have gotten HIV, which was once a death sentence, to an absolutely manageable place. And we see Americans and frankly, global citizens living full, and challenging and special lives while having HIV, polio having been eradicated. If we can only look to those as examples of what we can do to manage and eventually eradicate sickle cell disease, if we imagine ourselves being able to build the coalitions and build the capacity and put the plan into action. I look forward to seeing many of you all in the first NBCSL convening that we've had in many years, probably sometime later this year. But I will ask you, if you were on this call, what did you do to push the cause of eradicating sickle cell disease in your state? Have you filed the bill, or did we just come to this as a meeting? Ain't no more time for meetings. This is a call to action. And thank you, Global Blood Therapeutics. Thank you, Dr. Love, for your leadership. Thank you to all of the dynamic and energetic and talented representatives we had. Thank you to our production staff for putting this on, and to all of you all who participated in the comments. You all can feel free to stay and engage with each other, as well as with the panelists who remain around. But we want to take from this a call to action to your state legislature to build the coalitions, file the bills, and pass the bills to build the infrastructure to eradicate sickle cell disease. I'm Don Calloway from Enviva and MSNBC. Thank you all so much. Let's take this call to action to eradicate sickle cell disease in our lifetime.
Over the last decade, there has been more progress made in sickle cell disease research than in the prior 50 years. For far too long, the devastating impact of sickle cell disease, a lifelong inherited blood disorder, was under-recognized and deprioritized. While there is still much work to be done, the sickle cell community, including scientists, doctors, and industry, as well as patients, their families, and advocacy groups, have been instrumental in driving positive change.
I was diagnosed with sickle cell disease at 4 years old, and my family brought me to the United States for better health care. Growing up, sickle cell disease wasn't talked about much, and it was about 10 years ago that things started to change. The SCD community was given a platform and finally started to be heard. We gained allies dedicated to raising awareness and making progress. As a nurse, a sickle cell disease warrior, a patient advocate, and a mom, I'm inspired by companies like GBT and the advances they've made, who saw the overwhelming need and answered the call.
For Global Blood Therapeutics, the goal to improve the lives of those with sickle cell disease is more than just a scientific challenge. It's a deeply rooted mission.
From the very beginning, sickle cell disease was the singular focus of our efforts at GBT. It was incredible to us how marginalized research was in this space, despite a clear understanding of the molecular mechanisms underlying this disease. And for that reason, we believed we had a real opportunity to have a transformative impact on people living with this disease.
I first encountered sickle cell disease in medical school. Sickle cell disease disproportionately affects people of African and Hispanic descent, and has been neglected for decades because it affects minority populations. This neglect has resulted in long-standing disparities in health and healthcare faced by patients and their families. As a young Black physician, I was embarrassed and angry at how the system was treating patients. This system injustice stayed with me over the years, and I knew I had to take the opportunity to try to address this overwhelming unmet need.